So I'll talk about a painful subject called psychiatry. I'm not going to talk for very long, but I have had to lie to get help. They only take you if you're a danger to yourself or a danger to others. There's a bunch of reasons to get help if you're not thinking correctly and you know it. Psychosis. So anyway, what I see is a locked ward for people that need it. Yeah, I mean, some people it takes a few days or a week to not run and hide, or just to maybe be out of touch with reality. I don't know. There's paranoid schizophrenia, but we do need a place to recover. You know, maybe some people depression might take up to a month. They used to do that. They used to put you in a sanatorium out in the country where you could paint and walk and talk and get ready to go back and integrate in the society in which you left. Psychiatry used to give you a little more time. You talked to your psychiatrist long enough for them to really get a feel where you were at. Nowadays, it's 15 minutes once a week, and a doctor is supposed to be able. And what's amazing and beautiful now is they do have a bunch of different medicines, but a psychiatrist needs to know you, and the only way really a psychiatrist can diagnose you is by talking to the patient and listening to what the nurses and therapists say. Have a meeting, maybe even with you in the room. I think the benefit of being a psychiatrist in this day and age could get to be so much nicer if we would take care of our patients better and not treat them like the disability is a crime. And it doesn't have to be a crime if you catch it soon enough before it turns negative. So in schools, public schools, we need to introduce the idea of how to support a person with a brain illness that they may not see. We need to get them to see a therapist and a doctor before it turns to crime and turns violent. Not, maybe 1 in 20, 30,000 that would kill someone, but the anger felt from someone disassociated from society can get very violent, and I want to stop that. You become less productive in society if you're depressed. So I do think, honest to goodness, every person I meet has something psychotic. Something is not exactly perfect. And it almost scares me to see a perfect person because I always wonder what they're hiding. I got this idea to do stickers on our forehead about what our issues are. Everybody's got an issue. It's okay. But in the past, because there was no solving it, and the psychiatry was doing things really strange, they couldn't find the answers. They couldn't find the chemicals. They hadn't diagnosed it as a chemical. So lobotomies came in, things like that, just, to try to solve it in the most extreme measure that was unethical. But it's a lot better now. I mean, there is a time for ECT. Unfortunately, they were unethical with me because they couldn't fix me. And until I saw a brand new doctor, I went to a different doctor, they found the right medication for me. But I struggled for probably 8 or 9 years on the wrong medicines with very little support from my family or friends, because it's so horrible to be in a society that's so unknowledgeable about brain health, and everybody has it. So, I would say a holding cell for a week, and let's diagnose, and then move you out to the country and let you recover. These are people you love. These are people you care about, and you want them well. So let's treat the doctors well. They don't want to be stuck in a prison. Let's get these people that have brain illness, let's get them on the way to recovering. Let's get families involved in Glenn Close's group, NAMI, learning about how to support. And it is a complicated process, but we need to support each other. Thank you.